excipients, we have discussed about the vehicles, buffers, stabilizers, isotonicity modifiers, viscosity enhancers, preservatives, reducing agents, sweetening agents, and colorants. We have discussed about all these topics in our previous lecture. Then we have also discussed about the different methods by which we can increase the solubility of a drug. So, in today's section, we are going to cover about the introduction about the monophasic dosage form, and in this we are going to cover different dosage forms, that is syrups, elixirs, liniments, lotions, gargles, mouthwash, throat paints, enemas, eye drops, and nasal drops. We are going to discuss each of these monophasic liquid dosage form individually in our upcoming slides. First, before discussing each of these monophasic liquid dosage form, we should understand what a monophasic liquid dosage form means. But the liquid dosage forms are meant for internal, parenteral, and external use. The monophasic, as the name indicates, mono means single. The substances which have single phase are known as monophasic liquid dosage form. Monophasic dosage form refers to the liquid preparations containing two or more components in one phase system. It is represented by true solutions. A true solution is a clear homogeneous mixture that is prepared by dissolving a solute in a suitable solvent. Means we have to dissolve the solute in that solvent in which it is freely soluble. The components of the solution which is present in a large quantity is known as solvent, and the component which is present in the small quantity is known as solute. In this diagram, you can see that these black dots are the dissolved molecules of the solutes. Means they are completely soluble in this solvent system. This water is present in the large quantity and it is termed as solvent, and in which these solute molecules are completely solubilized. It means that a monophasic liquid dosage form will be homogeneous mixture, and it will be a clear solution, and it is also termed as a true solution. Now we will discuss about the advantages of monophasic liquid dosage form. It is easy to swallow, therefore easier for children and old age people. As it is liquid in form, so the elderly peoples and the children have difficulty in swallowing the tablets. Children prefer liquid dosage form over these solid dosage medicaments because of their better taste and flavor. Agents are added in it. So it is used in the case of children and old age peoples. It also facilitates the absorption of the drug faster than the solid dosage form, as the drug is readily in the solution form. As in the solid dosage form, we know that if we take a solid dosage form, it have to go through the disintegration and dissolution. So this step is not in the case of liquid preparations. That is why they are readily available for the absorption, and their rate of absorption is higher than that of the solid dosage forms. These monophasic liquid dosage forms are the homogeneous, and therefore it give uniform doses as compared to suspension emulsions which needs shaking. Which means that as we know that the solutions are the homogeneous mixtures, means the solutes are completely solubilized in the solvent systems. So in this case, there is no need of shaking, and there is no need of dispersion of this medicament in the solvent system. The solutes are already completely solubilized in the system, and therefore, but this is not in the case of biphasic liquid dosage form. In biphasic liquid dosage form, for example, suspension, in that the solute particles are not solubilized inside the solvent system. They are insoluble in solvent systems. So we need any suspending agents that will help us to suspend those solids in that formulation. But because of gravity, after some times, that solute particles will start moving down, and that process is known as sedimentation. So while using the suspension, we have to shake it so that the drug molecules are uniformly distributed in throughout the suspension while we take the medicament. This is not in the case of uh, on the monophasic liquid dosage form, because in monophasic liquid dosage form, the solute is already in a solubilized form in the it is completely soluble in the system, so we can easily take the drug without shaking. Monophasic, the next advantage of the monophasic dosage form is that they are very simple and fast to formulate. As the solute particles are easily soluble in the solvent system, so we do not need any kind of special treatment for their preparation. So because of their rapid solubility, they are very easy to formulate, and they are easy and fast to formulate. It can be administered by the various routes like oral route, parenteral route, enemas for rectal use, nasal and ophthalmic preparations. Means we can use these monophasic liquid dosage form through the different routes. We can take them orally, we can take them parenterally. Parenterally means through injections, and we can also take them through in the form of enemas, that we can insert these monophasic liquid dosage form through rectals. There are also some nasal preparations, means we can introduce into our nose, and there are some ophthalmic preparation. Ophthalmic preparation means the preparations that we use in our eyes. So these are the advantages of the monophasic liquid dosage form. Now we should discuss about some of the disadvantages of the monophasic liquid dosage forms. As they are very bulky in nature, so it is very difficult to transport and store a monophasic liquid dosage form, because they are liquid in nature. So it is, their handling is also very difficult as compared to the tablets. Water is commonly used vehicle which is prone to the microbial growth, so addition of preservative is needed. As we know that in the preparation of the monophasic liquid dosage form, the most common vehicle that we use is water, because water is compatible with shows high compatibility with other excipients, and the water is easily available, and water is cheaper, and there is other advantages, that the water has high dielectric constant, so it can solubilize a large amount of ionic solutes. So because of all these advantages of water, we use water as very commonly in the preparation of vehicles, very commonly used as a vehicle in the preparation of monophasic liquid dosage form. But there is a disadvantage of using a water. Water is very prone to the microbial growth. So the microbial growth in a monophasic liquid dosage form is very common. So we have to add some preservatives so that to stop the microbial growth. The next disadvantage is that when exposed to the direct sunlight, it may undergoes hydrolysis, so need to store in a cool and dark place. Whenever because if we do not properly store these monophasic dosage forms, because there is no any kind of coating or something over them, just a solute is dispensed in the liquid vehicle, so in that case, the chances of hydrolysis, as we open the lid of the container, and and if it comes in the contact with the environment, and the moisture that is present in the environment can cause the hydrolysis of the medicament. So it is recommended to store them in a cool and the dark place. The second and the next disadvantage of the monophasic liquid dosage form is that the drug stability reduces by hydrolysis and oxidation. Because of the water and because of the oxygen that is present in the environment, they can reduce the stability and cause hydrolysis and oxidation of the drug product. That is the reason that the monophasic dosage form or any liquid dosage form have a shorter expiry date than those of the solid preparations. We can easily coat or we can easily preserve the solid preparation in and we can prevent the direct contact of the medicament that is in the solid dosage form by coating them with any kind of polymer. We can preserve them to come in direct contact with the environment, but this is not in the case of liquid dosage form. So that is the reason they have shorter expiry date as compared to the solid dosage form. The other major sign of drug instability are change in color, precipitation, microbial growth, etc. These are the common instability problems of the drugs that are seen in the case of monophasic liquid dosage form. Means if we store a liquid dosage form for a long period of time, we can see that there is a change in the color of the preparation. And sometimes precipitation of the medicament can take place. This precipitation can be the reason because of the change in the pH of the solution. That can be one of the reason that the medicament get precipitated. And the last one is microbial growth. As I already told you, in monophasic preparations we use water as a vehicle, and which is very prone for the microbial growth. So in that case, we will find that in monophasic liquid dosage form, microbial growth is more. And there are many more instabilities like this in the monophasic liquid dosage form. Now the classification of the monophasic liquid dosage form. The monophasic liquid dosage forms are classified into two categories. One is the liquids meant for internal administration. The another one is the liquid meant for external administration. The liquids that we use internally means we take them internally. Our examples are syrups, mixtures, elixirs, and linctures. And the liquids that are meant for external administration are further classified into three categories. Those three categories are the liquid which are applied to skin, the liquid which are used in mouth, the liquid which are inserted in the body cavity. The liquids that are used in skin are lotions, liniments, and paints. The liquids which are used in mouth are gargles, mouthwash, and throat paints. The liquids that are inserted in the body cavity are droches, air drops, nasals, eye drops, and enemas. So this is the classification of the monophasic liquid dosage form. Based on this classification, we have different types of monophasic liquid preparations. In our further slides, we are going to discuss each of these preparations individually. We are going to discuss the method by which these preparations are prepared, and the ingredients that we are using, and the excipients that we are using for the preparation of these monophasic dosage forms. So let us start. Our first monophasic liquid dosage form preparation is syrup. Syrup is a concentrated aqueous solution of sugar, usually sucrose, in the concentration of 66.7% weight by weight, according to the IP, with or without medicinal and flavoring agents. It means syrups are the monophasic liquid dosage form. If we want to prepare a syrup, we have to take the sucrose in the concentration of 66.7% weight by weight, which is this formula is given in IP. These syrups can be flavored or can be medicated, or we can use it as a vehicle also. The flavored syrups are convenient for masking the disagreeable taste. If we are using a flavored syrup, or we can easily mask the disagreeable taste, because syrups are sweet in nature, and we can also mask the foul smell. If a formulation or if a drug have a foul smell, we can easily mask that foul smell also. The advantages of the syrups are they can act as an antioxidant by retarding the oxidation. Syrups can also act as an antioxidant by retarding the oxidation, such as sugar is hydrolyzed into the levulose and dextrose. If we oxidize the sugar, they will hydrolyze into levulose and the dextrose. The second advantage of the syrup is that they can act as a preservative by retarding the growth of the bacteria, fungi, and molds. And this happens because we are taking 66.7% of weight by weight. It means the solution of the syrup, the concentration of the sucrose that we are using to make a syrup is very high. So it has a high osmotic pressure. And this high osmotic pressure, and because of this high osmotic pressure, the bacterial growth and the fungi growth is retarded in the case of in the syrups, and they itself act as a preservative. Means if we are preparing a syrup, there is no need to add an preservative. They show self-preservative action. The other advantage of syrup is that it gives a good patient compliance, especially in the pediatric patients, as the syrup is sweet in taste. As the syrup is made up by sucrose, it is very sweet in taste, and the childrens like to have sweet things. So it gives a great patient compliance in the case of pediatric patient. Children can easily take medicament if it is dispersed in this syrup solution. Pleasant means of administering liquid dosage form of a disagreeable taste. If any medicament having a bitter taste, we can easily administer that medicament in these syrups. Because of their sweet nature, they will mask the bitter taste or disagreeable taste of that particular medicament. So this is another advantage of the liquid dosage form. The next advantage is that they are much liked by the adults and the children. As I already told you before, because of their sweet taste, and sometimes we add flavoring agents in the syrups, and this can be the reason that the children and the adults are very happy to take syrup as their medicament. This is also suitable for water-soluble drug, as the vehicle that we use in the preparation of the syrup is water. So those medicaments which are solubilized in water can be easily used in these formulation. Means syrup can be easily used as a dosage form for the preparation of those medicaments which are soluble in water. Now, there are some of the disadvantages of the syrup. The first disadvantage of the syrup is that it is not suitable for diabetic patient, because the syrup having the 66.7% of the sucrose in it, It means it has high percentage of sugar in it. So if a patient is diabetic patient, so it is not recommended for them to take a syrup. Second case is that because syrups may mistakenly take in extra dose as pleasant taste. That the children's, because of the sweeter taste of the syrup, children likes to use this syrup. Children likes to take this syrup. So because of their pleasant taste, children can mistakenly take extra dose, and this can cause the toxicity of the this. By this, the concentration of the drug in the blood plasma can increase and can cross the toxicity level of the blood. So this is the second disadvantage of the syrup. Third disadvantage is that the concentration is not appropriate, results in microbial growth. It means, as I told you, that the syrups itself act as a preservative, means it is a self-preservative. There is no need to add extra preservatives in it. But this happens only if the concentration is maintained at 66.7% weight by weight. If we do not maintain the concentration, and if any of the reason, it may be the moisture that is present in the environment and we are not storing these syrup properly, so if by any condition, if the concentration of the syrup is changed from the 66.7%, it will not act as a self preservative, and then there will be a chances of microbial growth. So this is the third disadvantage of the syrup. Now the next disadvantage is that if it is kept at cold temperature, the sucrose will crystallize. As we know, the syrup is made up of sucrose, means sucrose is dissolved in the water. At the cold temperature, the sucrose will crystallize, and if the temperature is warm, the syrup will show fermentation in it. Means we have to keep the syrup in optimized temperature. We cannot store the syrup in cold temperature, and we cannot also store the syrup at warm places. So we have to consider that the temperature in which we are storing this syrup should be optimal. These are the few disadvantages of the syrup. Now, there are three different types of syrups. First one is simple syrup, second is medicated syrup, and third is flavored syrup. We will discuss each of these types individually. First is simple syrup. When water is used alone for the preparation of sucrose solution, then we will say it is a simple syrup. Means in this only there are two components. One is water and another one is sucrose. A simple syrup, according to the IP, consists of 66.7% of weight by volume of sucrose in water. Means we only have to add 66.7% of sucrose in the water, and just by mixing the sucrose in water, we will get a syrup which is known as simple syrup. In some cases, we can add medicines also along in these syrups, and those kind of syrups are known as medicated syrups. The second category is medicated syrup. When this syrup contain medicinal substance used for the therapeutic purpose, example codeine phosphate syrup or ferrous sulfate syrup. Means when any medicinal substance is used or is added in the simple syrups, then we will say it is a medicated kind of syrup. The example is codeine phosphate syrup and the ferrous phosphate syrup. The third type is flavored syrup. When the syrup contain aromatic or flavoring agents, means If in a syrup along with this sucrose we are adding any aromatic or any flavoring agent in it, that kind of syrup is known as flavored syrup. These are the excellent vehicles for those medicaments which have bitter taste and have foul odors. We can use these medicated syrup as this flavored syrup as a vehicle. The example of the flavored syrup is orange syrup and lemon syrup. In this, the flavor that we are using is orange and lemon flavor. Now, next is the formulation component of the syrup, additives, ingredients, and the uses of the syrup. The main ingredients that we use in the preparation of the syrup is sucrose, and the other substituents of the sugar can also be used. Usually we use sucrose for the preparation of the syrup, but we can also use other sugar substituents, sweeteners and preservatives. We can also use sweeteners and preservatives. The second ingredient is the vehicle. Most widely we use water as a vehicle in the preparation of the syrups, but we can also use glycerin in some of the cases. Vehicles are the solvents, as we have discussed all these topics in our previous sessions. In my previous lecture, I have discussed about the different types of excipients that we use in the preparation of liquid dosage form. And one of those excipient is the vehicle. Now what are the vehicles? Vehicles are the solvents in which we are going to add our medicament as well as our excipients. Means it carries our excipients and it also carries our medicament. So in the preparation of syrup, water or glycerin is acting as a vehicle. We will add or we will dissolve this sucrose or these preservatives if we need in the water or in the glycerin to make a syrup. In syrups, sometimes we also need chemical stabilizers. Chemical stabilizers helps to prevent the crystallization of the sucrose. As we have discussed that if there is change in the temperature, if we keep the syrups at lower temperature or because of any environmental condition, there are chances that the sucrose can get crystallized, and we don't want that. To avoid that, we use chemical stabilizers. The example of the chemical stabilizers are glycerin, sorbitol, propylene glycol. These are the examples of the chemical stabilizers. Our next category, the next vehicle, the next excipient that we use for the preparation of the syrup is coloring agent. Amaranth, tartrazine solution, or many more are the few examples of the coloring agent. Now, why we need coloring agents? Coloring agents helps to provide the attractiveness to a particular formulation. If we are using any liquid preparation, if we add colorant in them, they will enhance their appearance. They will make them attractive. And our next additive is flavoring agent. Flavoring agents. Why we use flavoring agent? Suppose we have to take a drug which have foul odor or which have bitter taste. In that case, these flavoring agents are very helpful. These flavoring agents, these flavoring agents are of very different types. They can be from natural origin or they can be from synthetic origin. By using any of the flavoring agent, we can easily mask the foul odor of any drug. And because of that, it will enhance the patient compliance patient will easily accept that or easily take that medicament. Raspberry juice, lemon juice, vanilla flavors are the examples, and there are many more such coloring agents that we can use in the formulation of syrups. The next is preservatives. Usually, we do not need preservatives in the preparation of the syrup because the syrup can act as self-preservative. Because of its concentration of 66.7%, it will have a high osmotic pressure, which will not allow any microorganism to grow in that particular syrup. But still, because of the environmental condition, if whenever there is a change in the concentration, the the osmotic pressure that is maintained because of that concentration will not be there, and there are the chances that microorganisms can grow. So to inhibit that growth of microorganisms, sometimes we need some preservatives. The example of the preservatives that we use in the syrups are benzoic acid, sodium benzoate, methyl paraben. These are the few examples of the preservatives that we use in the preparation of the syrups. And last one is the medicament. As we have discussed, the syrups can be medicated syrups also. So the medicaments that we dispersed in the syrups are antibiotics, antiemetics, and analgesics. Lidocaine is the example of the antibiotic. Mipridine hydrochloride is an example of the analgesic. And chlorpromazine hydrochloride is the example of the antiemetic drugs. These are the drugs which can be dispersed in the syrups. Now, as we have discussed about all the excipients and about the drugs that can be used in the preparation of the syrup. Now, we will discuss about the methods of preparations of the syrups. There are three methods of preparation. One is solution with the aid of heat. Second is solution with the agitation. And third one is the percolation method. We will discuss each method individually. First is solution with the aid of heat. Sugar is added to purified water and heat is applied until solution is formed. When this solution is allowed to cool and volume is adjusted with the beaker. It means we just simply have to take the sugar and then dissolve it into the water by heating it. Until whole of the sugar has been dissolved in the water, we will have to heat that solution till then. And then we keep that solution aside for cooling, and after that the volume of that solution will be adjusted with the help of the vehicle that we are using. One precaution should be taken while making the syrup through this method is that after heating and heating the solution and heating the sugar in the water until the solution is formed, we should not cover the solution with a lid. For example, you are preparing a solution in a beaker, you are adding sugar and adding water and keeping that solution over a water bath, and whole of the solution of that sugar, all of that solute, that sugar is dissolved in that water. We should not cover that beaker with any lid. And why we should not cover? Because when the cooling is taking place, then the condensation of the water will take place at the lid by which we are covering it. And the water droplets will fall at the uppermost portion of the prepared formulation, and the concentration in the uppermost layer will not be 66.7. It will be diluted because of the condensed particles has been drops has been on the uppermost portion, and that will reduce the concentration. So it will promote the microbial growth or fungal growth over the uppermost portion. So it is advised that while using this aid of heat method, we should allow the solution to completely cool. We should not cover the solution. We should allow it to completely cool, and after the solution is cool, then only we can close the container. The second method is solution with agitation. Sugar and the ingredients are to be dissolved in purified water by placing in container and allowing it to agitate. Means we just have to place all the solutions and all the components that we want to use for the preparation of the syrup. Just we have to place all that components into the water, into the vehicle, and then keep on mixing, keep on agitating that mixture, and we have to keep on agitating till whole of the sugar is dissolved, and then we will make up the volume. It is quite time consuming as compared to the first method. In the first method, because the heat is we are applying the heat, so the rate of dissolution will be faster. But in the second method, we are only agitating the solution. We are only just agitating that solution. It will take some time to sugar to completely solubilize in that solution. So it is a quite time consuming process. The third process is percolation method. Sucrose is placed in a percolated with purified water as a solvent. By slowly passing the solvent through the column of the crystallization of the sugar to dissolve it. The percolate is collected and the process is repeated until the whole sugar is dissolved. These are the three methods by which we can prepare the monophasic liquid dosage form, that is syrup. Now, how we can dispense the syrup? It is dispensed in a well-dried, well-stopped bottle. The bottle should have narrow mouth and it should be amber color with plastic screw cap over it. Means we have to keep the syrup in a well-closed container. Next is the storage. The syrup should be stored in a cool place. By cool, doesn't mean it should be very cold, because at very cold conditions, the sucrose that is present in the syrup get crystallized. So it should be around 25 degrees Celsius. It should be a cool place in which we are going to store the syrup. Next is the label. After dispensing and storing it properly, the label is the essential part of a dispensing system. On the label, it should be written that it should be stored in fairly cool temperature, which means the temperature should not exceed 25 degrees Celsius, and it also should be kept in dark places. These conditions should be specified on the label so that a person can follow these conditions, and the shelf life of the syrup can be achieved. Syrup was the first monophasic liquid dosage form. We have discussed the vehicles that we use in the preparation of the syrup and the methods by which we can prepare the syrup. We have also discussed about the dispensing of the and storage of the syrups. The second monophasic liquid dosage forms are elixirs. Now, what are the elixirs? Elixirs are clear, sweetened hydroalcohol liquids intended for oral use, containing flavoring substances or active medicinal agents. It means elixirs are used for oral preparations. We can use, this comes in the category of liquid dosage form for monophasic liquid dosage form for internal use. Elixirs are very clear solutions and they are hydroalcoholic liquids, means we use alcohols in the preparations of the elixirs. There are primary solvents like alcohol and water with glycerin, sorbitol, propylene glycol and syrups, sometimes as an additional solvent or as a sweetening agent. Means along with water, we can use primary solvents like alcohol, glycerin, sorbitol, and propylene glycol. And sometimes we also use syrup as an additional solvent for the so that it can act as a sweetening agent. The concentration of the alcohol that we use in the elixirs is around 5 to 40%. Though elixirs are somewhat similar to syrup, they are less sweeter than syrup. They are clear solution, and in elixirs we use alcoholic liquids also. And the concentration of the alcohol in the elixirs is around 1 to 40%. Now, what is the advantage of using an alcohol? We are saying that in elixirs we add alcohol. So, why there is a need to add alcohol? What will be the advantage of it? Alcohol enhances the solubility of insoluble drugs in water. Means alcohol will act as a co-solvent. In my previous lecture, I have already discussed about what are co-solvents. It means if a drug is insoluble in water, then in that case, we can use alcohol along with the water. The drugs which are insoluble in water will solubilize the drug in the alcohol, and as we know that alcohol is freely soluble in water. So, alcohol will improve the solubility of insoluble drug in the water. If more than 20% of alcohol is present in our formulation, there is no require of preservative, because alcohol will act as a preservative. As I told you that we can use the alcohol in the concentration of 5 to 40%. If the concentration of the alcohol in an elixir exceeds the 20% of the limit, in that case, there is no need to add any kind of preservative, because alcohol will itself act as a preservative. These are the two advantages of the alcohol that we use in the elixirs. Now, there we will discuss about the types of the elixirs. There are mainly two types of elixirs. One is non-medicated elixirs, another one is medicated elixirs. From the name, we can easily understand what does this means. Non-medicated means in which the medicaments, in which the drugs are not present. Simply, the elixirs which do not contain any medicament but contain flavoring substances to make it acceptable are known as non-medicated elixirs. Similarly, the second type is medicated elixirs. When the elixir contains a medicinal substance used for a therapeutic purpose, in that situation, we will say this elixir is a medicated elixir. Like antibiotics, antihistaminics, antitussives, etc., can be used as a medicated agent in the elixirs. Example is piperazine citrate elixir paracetamol elixir. This is the diagram of the elixirs. This is one of the marketed formulation of the elixir. Now, as we have discussed the type of elixirs, now we are going to discuss about the components that we are going to use in the preparation of the elixirs and the additives and the ingredients and the uses of the elixirs. The first component is vehicle. We can use water, glycerin, and alcohol as the vehicle of the elixirs. These vehicles helps us to dissolve the ingredient within themselves. The second component that we use in the preparation of the elixirs is coloring agent. Amaranth, tartrazine are the example of the coloring agents that we can use in the preparation of the elixirs. There are many more coloring agents that we can use. And why there is a need of coloring agent? Because it helps in improving the attractiveness of the formulation. The next excipient that we use in the preparation of monophasic liquid dosage form is flavoring agent. Flavoring agent helps us to mask the foul odor of the particular formulation of the particular drug. So, the example of the flavoring agents are raspberry juice, lemon juice, vanilla flavors, orange oil, tincture of lemons, and many more. We can use any of these flavoring agents in the preparation of the elixirs. After this, the next component or the next excipient that we need in the preparation of elixirs are preservatives. Benzoic acid, sodium benzoate, methyl paraben, chloroform spirit, methyl ester of para-hydroxybenzoic acid. These are the few examples of the preservatives in the case of that we can use in the preparation of elixirs. These preservatives are used to inhibit the microbial growth. But as we use alcohol in the elixirs, as I already told you, if the concentration of the alcohol is more than 20%, there is no need to add these preservative in the elixirs, because in that case, alcohol itself acts as a preservative. So these are the different vehicles, these are the different excipients that we use for the preparation of the elixirs. The next is the medicament, means the drug. We can dispense antibiotics, antihistaminics, and sedatives in the elixirs. These drugs are used for the therapeutic purposes. The next excipient that we used in the preparation of elixirs are sweetening agents. Sucrose, saccharin, syrups, and glycerins can be used as a sweetening agent in the preparation of elixirs. We can directly use sucrose or saccharin, or we can also use syrup. Syrups we have discussed in our first formulation. We can directly use syrups also as a sweetening agent in the preparation of the elixirs. And why we use these sweetening agent? To enhance the taste of the elixirs. And they can also mask the bitter taste of the medicaments that we are going to dispense in our elixirs. The next excipient is stabilizer. EDTA and citric acids are the stabilizers that we can use in the preparation of the elixirs. And why there is a need of stabilizer? Because the stabilizer helps us to stabilize the product by minimizing the darkening that occurs on storage. It means if we are not using stabilizer and if we are keeping the elixir for a longer period of time, there we can see the change in the color. So to minimize that darkening of the elixir, to minimize that darkening of the color of the elixirs, we use stabilizers in the elixirs. Disodium aditate should be used to sequester heavy metals that catalyze decomposition of the antibodies. Means these heavy metals act as a catalyzer to in the decomposition of the antibiotics, and to stop that we can use disodium aditate as a sequester to dissolve these heavy metals. These are the excipients that we use in the preparation of the elixirs. Now, we should discuss about the methods of preparations of the elixirs. Elixirs can be prepared simply by dissolving. We can divide it into two parts. The components which are soluble in water are solubilized in the water phase. It means to dissolve the water soluble ingredient in the part of the water and dissolve the sucrose in it. Sweetening agent is also added in that water phase. In second phase, dissolve all those ingredients which are soluble in alcohol. It means if my drug is water soluble, I am going to add that drug in the water phase. But if my drug is not soluble in water, then I am going to add that drug in the alcohol. Means we are going to prepare this elixir in two parts and then again mixing those two parts together. One part is your water part, and we are going to dissolve all the ingredients that are soluble in water phase, and the ingredients which are soluble in alcohol are going to dissolve in the alcohol. The concentration of the alcohol should be around 5 to 40%, and this is to make a clear solution. In the third step, the aqueous solution is then taken and added it into the alcoholic solution. Means the aqueous solution that we have prepared in the first step will be taken and added into the alcoholic solution that we have prepared in the second step. With the constant stirring, we have to continue. The stirring should be constant, and the volume is make up with the solvent and the vehicle specified in the formulation, and then we will make up the volume up to the amount that we need. We will make up the volume by using a vehicle or the solvent that is specified in the preparation of the formulation. Elixirs should be brilliantly clear and therefore stained or filtered if necessary. After mixing of these two phases, this aqueous phase and this alcoholic phase together, we have to stain the elixirs, because elixirs should be very clear solution. So they are stained or filtered if necessary. If it is required, then we can do this also. The fourth step is a high alcoholic content is maintained during the preparation by adding the aqueous phase to the alcoholic phase. We will add the aqueous phase into the alcoholic phase to maintain the high alcoholic content. This is the method by which we will prepare the elixir. Now, the label of the elixir should contain all the necessary requirements of the liquid dosage form meant for internal use. It means it should also specify the concentration or the amount of the alcohol that is used in that preparation. The concentration of the alcohol that is used in the preparation of the elixirs should be specified on the labels. Next is dispensing. How we will going to dispense the elixirs? It should be dispensed in narrow mouth, screw capped, colorless, plain bottles. Means we have to use colorless bottles, and that should have narrow mouth, and they should be screwed cap. Storage, it should be stored at cool place to prevent the volatilization of the alcohol at high temperature, because in the preparation of elixirs we are using alcohols, and as we know that alcohols are volatile at high temperatures. So if we are not taking in consideration the temperature, and we are not storing it in proper storage condition, and we are storing it at high temperatures, there are chances that the alcohol can get vaporized, and the concentration of the elixirs will be not same as at the time of the formulation. What are the advantages of elixirs over syrup? How these elixirs are more suitable than the syrups? The first advantage is that it is less sweeter than syrup. The first advantage is the syrups are very sweet in nature, but elixirs are less sweeter than the syrups. The second advantage is that as in syrups, there is high concentration of sucrose, that is around 66.7%, which makes syrups highly viscous in nature. So, elixirs are more fluid than liquids. It means elixir, because of the lower viscosity of the elixirs, uh, they show more fluidity as compared to syrups. The third advantage of the elixirs over syrup is that it often a desirable. It is more effective in masking such taste. It is more effective in masking the foul odors, and it is more effective in masking the taste of formulations than syrups. Elixirs are more stable than the syrups because they are not that much concentrated, and because we use alcohol in the preparation of the elixirs, so alcohol that is present in the elixirs itself act as a stabilizer, so it itself act as a preservative. So that is the reason that the elixirs are more stable than the syrups. Elixirs are more readily prepared and manufactured than syrups. It is very easy to prepare an elixir, and it is very easy to manufacture an elixir than a syrup. And the last advantage of elixir over syrup is that the elixir can contain both alcohol and water soluble ingredients, because alcohol can act as a co-solvent for the water. Means the drugs which are not soluble in water and we want to dispense them in it, we can dispense those drugs in alcoholic phase and then mix both this alcohol and water together. It means we are increasing the solubility of the ingredients in the water. So in the case of sugar, this is not possible, because the vehicle that we are using is only one vehicle we are using, that is water. So the drugs that are water soluble can only be dispensed in the case of syrup, but this is not in the case of elixirs because of the presence of the alcohol. These are the few advantages of the elixirs over syrup. Now, elixirs also have few disadvantages. The first disadvantage is that elixirs contain alcohol. Sometimes the concentration of alcohol is very high. It is because it ranges from 5% to 50% alcohol can be used in the elixirs. So alcohol is not good for children. So we cannot give elixirs with high concentration of alcohol to the children. The second disadvantage of the elixir is that because they contain volatile materials, it should be stored in a watertight screw top jar and away from the source of ignition. Because we are using alcohol in the elixirs, so there are very much chances that at higher temperature the alcohol can get volatile. So we have to keep these elixirs in watertight top jars, as alcohol is flammable. It can catch fires. So we also have to keep these elixirs from the sources of ignition. Means from it should be kept away from where these elixirs can catch fire because of the presence of the alcohols in the elixirs. These are the disadvantages of the elixirs. Our third monophasic liquid dosage form is liniment. Alcoholic or oily clear solutions intended for application to the skin with friction or massage and should not be applied on the broken skin. Now, liniments comes under the category of monophasic liquid dosage form for external use. Means these liniments are used externally. The two preparations that we have discussed before, one was syrup, another one was elixirs. Those two comes in the category of monophasic liquid dosage form. Monophasic liquid dosage forms that comes in the category for internal use. So these liniments comes in the category for the monophasic liquid dosage form comes for the external use. Now, what are these liniments? Liniments are prepared by using alcohol or oil bases. These are the clear solutions which are intended for the application to the skin with friction or massage. We have to apply it over the skin by with friction or by massaging it, and it should not be applied to the broken skin because we are using alcohol in the preparation. We are using alcohol in the preparation, so it is not advisable to apply the liniments on the broken skin because it can cause irritation on the wounded area or on the broken skin. The liniments are rubbed onto the affected areas, and because of this, they are once called as embrocations. Because if we want the action of a liniment, we have to rub it on the affected areas. So they are once called as embrocations. They are applied with friction and rubbing to the skin. If we want the effect of a liniment, we have to apply it by rubbing and we have to apply friction on the skin. The oil or soap base provides for a ease of application and massage. If we are using liniment for the purpose of rubbing or for the purpose of massage, we should go for the we should go for the soap base or oil base type of elixirs, because soap base and oil base type of elixirs provide an ease of application and massage on the skin because they are greasy in nature, so it become easy to massage if we are using these soap and oil base. In this figure you can see a codeine linctus. This is a marketed formulation of a linctus. Now, what are the general uses of liniments? Liniments can be used as antipyretics and astringents, emollients, analgesics, rubeficants, and counter-irritant. We can use liniments for any of these purposes. What are antipyretics? They are used, these are those agents that helps in relieving the itching. Means these agents are used in that case when a patient is suffering from itching. These agents helps in relieving the itching. Next is astringent. Astringent causes biological tissues to contract. Next is emollient. Products that soften the skin and treat the dry skin. Usually it provides moisture to the skin, it helps in softening the skin, and it helps to treat the dry skin. Usually in winters we use these emollients. Next is analgesics. Analgesics are those substances which helps in reducing the pain. Analgesics can also be used in the case of liniment because liniments are used by rubbing. So the area in which we are having a pain, in that area we can apply these liniment by rubbing, and it can help in reducing the pain. Rubeficant. Rubeficant means the substances that cause redness. Counter irritant. An agent applied locally to produce superficial inflammation with the object of reducing inflammation in deeper adjacent structures. These are known as counter irritants. So it means liniments can be used for any of these purposes. These are the general uses for the liniments. Now, what are the advantages of the liniments? Liniments are used as a rubeficant, counter irritant, and penetration enhancer in the skin. As I have already told you that in the preparation of these liniments we use two things. We can also use alcohol as a base, and we can also use oil or soap as a base. If we want to increase the penetration of a drug, or if we want a penetration action, in that case we use alcohol because it will act as an penetration enhancer. So these are the advantages of the liniments. Now the disadvantages of the liniment. The liniments reduce rubbing, so patient may feel uncomfortable. Because if we want the action from the liniment, we have to rub it on our skin, and that rubbing can cause uncomfortableness for few patients. And the second is the alcohol or the hydroalcoholic solutions. As in the preparations of the liniment, we use alcohol or hydroalcoholic solutions. These alcohols can cause skin irritation, especially as I already told you that the liniments cannot be used on the broken skin. If we use the liniment containing alcohol as a base in the broken skin, it can cause irritation to that area. So these are the disadvantages of the liniment. Next is the formulation components of the liniment, additives, ingredients, and their uses. Means what are the excipients that we need in the preparation of the liniment? The first excipient is the alcohol. Oil like peanut oil, sesame oil, cottonseed oil, etc. can be used as a vehicle for the preparation of the liniment. The solvent selection is based on the action, whether we need a massage or we need a deep penetration into the skin. Based on that, we will select our vehicle. If we need a massage, in that case, we are going to use these different oils. But if we want a deep penetration action, in that case, we are going to use the alcohol. So on the basis of the action what we need, we are going to select our vehicle. Next is the flavoring agent. Rose oil, jasmine oil, and lemon oil, and many more are the examples of the flavoring agents that we can use to enhance the pleasant smelling of the medicaments. Means, if we are applying a medicament having a flavoring agent, it will give us a pleasant smell. The next is counter irritant. Camphor is used as a counter irritant in the formulation of the liniments. Next is, these are the drugs. Camphor acts as a counter irritant. For analgesics, means for pain relieving, we can use methyl salicylate for the therapeutic purpose. Now, these are the excipients that we have discussed that we can use in the preparation of the liniment. Now we will discuss about how we can prepare the liniment. The vehicles should be selected for the type of action desired. As I already told you that which type of action I want. For that, we are going to select our vehicle first. Whether I want a rubefacient action, whether I want a counter irritant action, or I want a massage. According to this, we are going to select our vehicle. And also on the solubility of the desired component, the vehicle in the various solvents. And if we want to dispense a medicament, if we are going to dispense a medicament in the liniment, in that case, we will also consider that point in which of the vehicle our medicament is solubilized easily. We will select vehicle on the two bases, that the action that we are going to need, and second is the solubility of the drug component. And liniments are prepared in the same manners as solutions. Means just we have to select the vehicle, and in that vehicle we have to dispense all the ingredients, means all the excipients that we have discussed before in that vehicle, and by agitation we can simply prepare the liniment. They are very easy to prepare. Now the types of liniment. Liniments are of two types. There are alcoholic liniments, and second category is oleaginous liniments. We will discuss both of these types individually. First is alcoholic liniments. Alcoholic liniments used generally for their rubefacient, counter-irritant, mildly astringent, and penetrating effects. In the cases where we need these kind of actions, we are going to choose alcoholic liniments. They help to penetrate in the skin more readily than those of the oil bases. If I want to enhance the penetration of the medicament in the skin, I can use these alcoholic liniments. They show better penetration because alcohol will act as a penetrating agent, and they show better penetrability as compared to oil base. We call them, from the name you can easily understand why we call them alcoholic liniment, because alcohol will be the vehicle that we are going to use in the preparation of the liniment. Example is soap liniment. The second type is oleaginous liniments. They are milder in their action, but is more useful when massage is required. Because of the greasy nature of the oils, it is very easy to massage. They form a slippery surface and it becomes easy to massage over the skin. So if we require a massage action, For that case, we are going to use these oleaginous liniments. They are less irritating to the skin depending on their ingredients, because we are using oil in this case, so they cause less irritation as compared to alcohol, which cause more irritation to the skin. They may function solely as a protective coatings. In this oleaginous liniments, oil is used as a solvent or a vehicle. And the example is camphor liniment. There are some important points about the liniments. Liniments should not be applied to the skin that is bruised, broken, because of the excessive irritation might occur. There are few points that should be considered while using the liniments. First point is they should not be used on the broken skin or bruised skin. Because of the presence of alcohol, they can cause excessive irritation in that area. So this point should be considered while using the liniment. This application should be marked for external use only. While formulating this liniment, and while dispensing this liniment, there on the label it should be marked that it is only for the external use, because it comes into the category of external use preparations. Next is dermatologists prescribe products of this type, but only those containing the rubefacient are advised extensively and used by the consumers for treating the minor muscle aches and pains. I repeat, dermatologists prescribe products of these types, but only those containing rubefacient and advisable extensively and used by the consumers for treating the minor muscle aches and pains. In the case of minor muscle aches and pains, these liniments can be used, and they are prescribed by the dermatologists. Now, the dispensing of the liniments. Amber colored containers, narrow mouth bottles, tightly closed with colored plastic screw caps are used for dispensing the liniments. The label of the liniments should contain these conditions should be written on the label. First is this is for external use only. Next is not to be applied on the broken skin. And last one is the shake well before use. These are the three conditions that should be mentioned on the label while dispensing these liniments. Now, storage. Liniments should be stored in cool and dark place away from the flame, because some of the liniments can contain alcohol as their base or as their vehicle. So alcohol is flammable. So we have to keep these liniments away from the flames, and it should be stored at cool and dark place. Our fourth external monophasic liquid dosage form is lotions. Lotions are the clear solutions of aqueous or oily. These are suspensions or emulsions intended for the application to the skin without friction. This is the basic. Liniments are also for external application and application on the skin, and lotions are also the external monophasic liquid dosage form that are used for application on the skin. The basic difference between the liniments and the lotion is that liniments are applied by rubbing, but in the case of lotions, there is no friction is required. Means these lotions can be applied to the skin without friction. Now, what are the advantages of these lotions? They are soothing and applied gently by dabbing. We can easily dab these lotions on our skin, and they are very soothing in nature. This is one of the advantage. We don't have to rub, we just have to apply, we just have to dab that lotion on our body. Next is they are comfortably spread without rubbing. We don't have to rub. As in the case of liniment, we have seen that they are applied by rubbing. But in the case of these lotions, we do not have to spread them by rubbing. We can easily just tap it on our skin. Alcoholic lotions provide cooling effect on applications. The lotions that contain alcohol in their preparation can cause cooling effect when they are applied. These are the advantages of the lotions. Now, we will discuss about the disadvantages of the lotion. The first disadvantage is that alcohol or hydroalcoholic lotions get dried easily and hence not suitable for prolonged action. The lotions that contain alcohol or hydroalcohol in as a base, as a vehicle, should not is not suitable for a prolonged action, because alcohol can get easily dried, they can get easily evaporated, so they are not suitable for prolonged action. This is the disadvantages of the lotions. Now, the formulation component of the lotions and the additives, ingredients, and the uses of the lotions we are going to discuss in this slide. The vehicles that we used in the preparation of the lotions are alcohols, isopropyl alcohol, water, liquid paraffins, isopropyl myristate, etc. can be used as a vehicle in the preparation of the lotions. As I already discussed, vehicle are the act as a base for the solubility of all the ingredients and the drug within itself. Next, excipient is co-solvent. Glycerol, glycerine, polypropylene glycol, PEG 400, PEG 600 are used as a co-solvent to increase the solubility of those drugs which are not soluble in water. Means these agents act as a co-solvent and they will increase the solubility of the drug by the phenomena called as co-solvency. Next, the flavoring agents and the coloring agents. We can use the colors that are approved by food and drug cosmetics, that are approved in food and drug cosmetics. The colors are cherry color, raspberry, apple, rose. These are the flavoring agents that we can use. These flavoring and coloring agents helps in enhancing the acceptability of a particular lotion. This color will improve the appearance of the lotion, and this coloring agent will improve the appearance of the lotion, and these flavoring agents will make those lotions acceptable. The medicaments can also be used in the preparation of lotions. The medicaments that we use are astringent, and example of astringents are copper and zinc shipmates. We can also use erythrolytics, fungicidal, bacteriostatic kind of medicaments for their therapeutic purposes. These are the medicaments that we can use in the lotions. Next is preservatives. Chlorobutanol, benzyl alcohol, beta-phenyl ethyl alcohol, etc. are the additives that we can use in order to prevent the microbial growth in the lotions. Now, the methods of preparation of lotions. In this also we are going to use simple solution method. We will take an example, sulfate lotion. If we want to prepare a sulfate lotion, we will accurately weigh zinc sulfate and sulfonated potash and dissolve them separately in 20 ml of purified water. Then add dilute solution of sulfonated potash to the dilute solution of zinc sulfate slowly. Means at first step we have to we will take 20 ml of water separately, and in one we are going to add zinc sulfate, and in another we are going to add sulfonated potash. And these dilute solution of sulfonated potash and the zinc sulfate are going to we are going to mix them together by a constant stirring that we have discussed in the second step. Then transfer the content to a measuring cylinder and make up the final volume of the water. This is how a sulfate lotion is prepared. The important points should relate to the sulfate lotion is that while dispensing the lotion, shake vigorously in order to achieve the fine precipitates of zinc sulfide. Second consideration that should be taken while preparing a sulfate lotion is that zinc sulfate and sulfonated potash act as an astringent. Therefore, sulfite lotion is used as local astringent. The next condition is it is also used as a protective. Sulfite lotion is also used as antiseptic in the treatment of acne and seborrhea. Just like eczema, scaly, itchy and reddish patches appears generally on the scalp and the face. Seborrhea usually affects the sebaceous gland rich area of the skin. These are the important points related to the sulfate lotion. The next example is precipitated sulfur lotion. For this, the ingredients that we required are precipitated sulfur in 1.5 gram, glycerin 1.5 ml, sodium lauryl sulfate 0.075 gram, alcohol 4.5 ml, rose water 30 ml. Uses of these ingredients are: this precipitated sulfur will act as an astringent or antiseptic. Next, this glycerine will act as an humectant and soothing effect, and also improves the wettability of the precipitated sulfur. Sodium lauryl sulfate. The next ingredient is sodium lauryl sulfate. This will act as a surfactant. Alcohol will gives us the cooling sensation. As the evaporation causes cooling, the alcohol will evaporate and it will cause cooling sensation. And this rose water is used as a vehicle and as a flavoring agent to give the pleasant odor to the lotion. These are the uses of all these excipients. Dispensing of the lotions should be in the colored fluted bottles. The labeling of the lotions should contain, they should be written that these are for external use only. And it is also mentioned there that shake well before use. Storage of the lotions. Lotions are stored in the well-closed airtight container and kept in a cool place. Our fifth monophasic dosage forms is gargles. They are aqueous solutions used in the prevention or treatment of throat infections. Usually, they are prepared in a concentrated solutions with direction for the patients to dilute with warm water before use. Means the container in which we get these gargles are in concentrated form. We have to dilute them with warm water before using it. They brought in intimate contact with the mucous membrane of the throat and allow to remain in contact with it for few seconds before throw out of the mouth. We all know how gargles work. We just have to intimate its contact to the mucous membrane of the throat. By using air from the lungs, we will keep that gargle for few seconds on that throat and then throw it out of the mouth. The containers that are used for the gargles are clear glass bottles or plastic screw caps. Colored bottles are required to be used if protection is required. The labeling should contain for external use only, and proper dilution instructions should be written on gargle. As I already told you that gargles comes in concentrated form. So there should be proper dilution instructions should be written on the label how we have to dilute those gargle before using it. Now, the methods of preparation. They are usually prepared by dissolving all ingredients in solvents and then make up the volume as required. It is just simply we have to dissolve all the ingredients in the solvent. Normal solution method is used for the preparation of the gargles. The advantages of the gargles are that they are easy to treat, easy to use for the treatment of the infections of the pharynx. Just by gargling the solution from using air from the lungs, we can easily treat the infections that are on the pharynx. They also help in relieving the soreness and the mild throat infections. The next advantage is that they are supplied in concentrated form. So, because of that, the container size is reduced. We have to take few quantity of that gargle and then dilute it with warm water before using it. So container size has been reduced. Suitable for variety of drugs like antibiotics, antiseptics, and etc. We can dispense these kind of drugs in the gargles. Now the disadvantages of the gargle. The first disadvantage is that they will temporarily affect the drug because the contact time of the drug in the infected area is very less, so they give a temporary effect. They are not suitable for the patients having a respiratory problems because for gargles we have to use air from our lungs to keep it for a time in our neck. So for that, in that case, the patients that having the respiratory problems cannot use these kinds of preparations. And third disadvantage is that while gargling, there may be a possibility that a small quantity of those gargles can be swallowed. Now, the formulation components of gargles, additives, ingredients, and their uses. The core solvents that are used in the preparation of the gargles are glycerin, polyethylene glycol, and etc. to enhance the drug's solubility. The vehicle that we use are water and sometimes we use alcohol also to dissolve the excipients. Coloring agents, amaranth, tadrazine solutions, or any other FDA approved color can be used in the gargles to improve its attractiveness. Flavoring agents like cardamom oils, cinnamon oils, menthols can be used to enhance its acceptability. Preservatives like phenol, chlorosirols, benzoic acids, and its salts can be used to inhibit the growth of microorganisms in the gargles. So, These are the excipients that we use in the preparation of the gargles. The medicaments that we can disperse in the gargles are phenol, thiamol, that will act as an anti-infective. Potassium chloride can be used as an astringent. Volatile oils can be used as an antiseptics and deodorants. Potassium permanganate can be used as a bactericidal. These are the medicaments that can be used in the preparation of the gargles. We also use antioxidants while one of the excipients in the preparation of the gargles. Ascorbic acid, sodium bisulfite, sodium metabisulfite, thiourea are the different types of antioxidants that we use to prevent the oxidation of the drug. Our next monophasic dosage form is mouthwashes. These are the non-sterile aqueous solutions with pleasant taste and odor used for oral hygiene, cleaning and dendrize the buccal cavity. And they are also sometimes used to treat the infection in the mouth. This Listerine is an example of the mouthwashes that we commonly use. This is the marketed preparation. Container must be white fluted bottles. The labels of the mouthwash should contain the proper direction for mouthwash dilutions must be mentioned. How we have to dilute these mouthwashes before using it should be mentioned on those labels. Label should also contain that this is for external use only, provided in the pH range of 5 to 9.5. It should also contain an instruction that it should not be swallowed in large amount. These are the conditions that should be mentioned on the labels of the mouthwashes. Now, what are the advantages of the mouthwashes? Mouthwashes are utilized to remove the loosened debris and food from the mouth. They provide the deodorant, refreshing, local analgesic, and astringent effects. Sometimes used to treat the mouth infection by using antibacterial agents. Now, the disadvantages of the mouthwash is that if the pH of these mouthwashes are not monitored properly, they may damage the mouth tissues. So, in the preparation of mouthwashes, this should be considered that the pH should be maintained. Now, the classification of the mouthwashes. Mouthwashes are generally classified as cosmetics, therapeutics, and combination of these two. First is the cosmetic rinses. They are the commercial products that remove oral debris before or after brushing, temporarily suppress the bad breath, diminish bacteria in the mouth, and refresh the mouth with pleasant taste. Mouthwashes that are used for therapeutic purposes are the therapeutic resins along with the benefits of their cosmetic counterparts. They also contain an added active ingredient, for example, fluoride or chloral hexidine, that helps against the protection of some oral disease. These are the two types of mouthwashes. Now, the mouthwashes are for the components that we use for the formulation of mouthwashes, and the additives and the ingredients that we use are: first component is co-solvent. Glycerine, polyethylene glycol is used to enhance the solubility of the drugs in the mouthwashes. Vehicles that we use are Most commonly, we use water as a vehicle in the mouthwashes, but sometimes we can also use alcohol to increase the solubility of the excipients. The coloring agents that we use are amaranth, tartrazine solutions, or any FDA approved color, etc., for the attractiveness of the mouthwashes. Flavoring agents such as spearmint, peppermint, eucalyptus, and menthol can be used to get rid of unpleasant smell and the taste of other raw materials and give a cold, refreshing taste. In mouthwashes, these flavoring agents plays an important role. Preservatives are also added in mouthwashes. The examples of the preservatives that we use are phenol, benzoic acid, and its salts, like sodium benzoate. These preservatives help in inhibiting the bacterial growth. Medicaments that we can dispense through the mouthwashes are phenolthiamol, which will act as an anti-infective. Zinc sulfate, zinc chloride will act as an astringent. Volatile oil will act as an antiseptic and deodorants. Potassium permanganate will act as a bactericidal, will give us a bactericidal effect. These are the medicaments that we use in the preparation of mouthwashes. Now, what are deodorants? Sodium chloride and sodium bicarbonate as a hypertonic solution is used to deodorize the mouth cavity. Sweetening agents are also used in the preparation of mouthwashes. Examples of the sweetening agents are sodium saccharin, sorbitol, glycerol, xylitol. These helps in improving the taste of the mouthwashes. Alcohols are also used. Alcohol ranging from 18 to 26% will act as a preservative and will also give helps in improving the solubility of the ingredients. Now, the methods of preparation of mouthwashes. Simple solution method is used to prepare the mouthwashes. We just have to solubilize all the ingredient in the solvent and co-solvent till the clear solution is obtained. Just we have to solubilize all the ingredients in the vehicles. By this, we can get the mouthwashes. Our next monophasic liquid dosage form is throat paint. Viscous liquid preparations used for mouth and throat infections. Paints can be applied onto the skin and mucous membranes, but all paints cannot be used for the application on mucous membrane. The container that we use to store the paints, throat paints, should be airtight and color fluted bottles. The label should, on the labels, there should be written that it is only for external use. It should contain the auxiliary labels like throat paints usually contain volatile oils as flavoring agents. Therefore, to prevent the volatilization at the higher temperatures, it should also be mentioned on the labels of the throat paints. It also contain the label should also contain that it should not be swallowed in large quantities and the container should be tightly closed. Now, the storage of the throat paints dispensed in airtight container and stored in a cool place. The directions: throat paint should contain the directions to the patient. Apply with camel brush as directed. These directions should also be mentioned. Now, what are the advantages of throat paints? The first advantage is used for the treatment of throat infections and mouth infections. Throat paints are highly viscous solutions, so retained to the applied place for a longer period of time. Because of their higher viscosity, we can retain them on a particular site for a longer period of time. Glycerine is used as a solvent which provides viscosity and turns liquid sweet. Now, the disadvantages of throat paints are they are applied with the help of a brush or small cotton piece, which may be uncomfortable for a patient. Any initiative, they initiate salivation, and hence the patient has to split again and again. This will cause discomfort to the patient. These are the two disadvantages of the throat paint. The formulations for the formulation of the throat paints, we need a solvent. Viscous solvent must be used to retain the formulation at the site of the action for a longer period of time. So we use liquid paraffin or glycerine as a solvent. Medicaments that we use in the formulation of throat paints are antiseptics, iodine and crystal violet. Astringent, the examples are tannic acids and boric acids. Anti-infectives, the examples are phenol and thiamine. Third is flavoring agent. They get rid of the unpleasant smell and the taste of the other raw materials and give a cold, refreshing taste. Example is water insoluble essential oils such as spearmint, peppermint, eucalyptus, and menthol are used as a flavoring agent in dissolved with the help of a co-solvent. Coloring agent. It gives an attractive appearance to the throat paints. F and D approved all the colors can be used as a coloring agent in the throat paints. Sweetening agents are also used to improve the taste, and examples are sodium saccharin, sorbitol, glycerol, and xylitol. These are the sweetening agents that we can use in the preparation of the throat paints. Preservatives helps us to prevent the growth of the microorganisms in the throat paint, and the examples are sodium benzoate, methyl paraben, and ethyl paraben. Now, the methods of preparation for throat paints. Throat paints are prepared by simple solution method with the aid of the heat. We just have to solubilize all the ingredients in the vehicle, and we have to apply heat till the solution is completely till the solutes are completely solubilized in the solution. A next monophasic liquid dosage form is enemas. Enemas are the aqueous or oily solutions or suspensions or oil in water type of emulsions which are intended to introduce into the rectum for cleansing, therapeutic, and diagnostic purposes. They are also used to cause evacuation and for local or systemic or therapeutic action of the medicaments. Now, dispensing of enemas. Enemas are dispensed in colored fluted bottles, glass bottles, along with the rectal nozzle. Nowadays, enemas are supplied in a single use. Squeeze plastic bottles or disposable polyethylene or polyvinyl chloride bags sealed with rectal nozzles which should be lubricated before administration are used commonly. Directions: warm up to the body temperatures before use. And this direction is only in the condition where a large volume of enemas we are going to use. And they should be administered as directed. Storage. The enemas should be stored in cold and dark place. The label. Next is label. Label should bear all the necessary requirements of the liquid dosage form except dose. Auxiliary label. In addition to the information provided on the type label, it should be necessary to use auxiliary labels to provide supplementary information regarding the proper and the safe administration, use, and the storage of the product. Means, along with the label, these auxiliary labels should be provided in which the supplementary information regarding the product should be given on it. The informations like these are only for rectal use. Lubricate the nozzle before using it. Warm to the body temperature if we are using large volume of enemas. They should be stored in cool and dark place. Use within 2 days after issue or discharge the remaining portion after the 2 days of issuing. Keep away from the reach of the children. These information should also be written on the label. Advantages of enemas are they are suitable for local and systemic effects also. Second, the drug which are not given by the oral or parenteral routes preferred by this route. Administered in large volumes. Used for study of the lower GIT, it contains X-ray contrast mediums. Now, the disadvantages of enemas are that patient may feel uncomfortable. And for inserting the enemas, it requires assistance or a nurse for its administration. Now, the types of enemas. There are 3 types of enemas. First is cleansing enemas, second is therapeutic enemas, and last one is diagnostic enemas. Cleansing enemas contain those enemas which helps in are also termed as evacuating enemas. These are used to evacuate feces in constipation and before any surgery of the gut. The volume of enemas depends upon the age and the condition of the patient. As I already told you, the large volume enemas should be warmed to the body temperature, that is 37 degrees Celsius, before administration. This is done to prevent the cold stroke. Warm water will stimulate interstitial mucosa and the cold water will produce cramping. So we have to warm the water before we use it. Enemas are also used as therapeutic enemas. These are medicated enemas. These are used to produce medicated effect in the bowel or in the lower part of the colon in the children's and in comatose patients. This action may be obtained by its local action, as in this case, piles, ulcerative colitis, and inflammatory bowel disease can be treated, or systemic means therapeutic actions can be done. They contain a therapeutic agents like sedatives. Example is chloral hydrate and paraldehyde. They can also used as anti-enthelmetics. Acacia is used for the threadworms. It is used as anti-inflammatory agents. Corticosteroids are used as anti-ulcerative colitis. Nutrients, vitamins and minerals are used as nutrients. The third category of enemas is diagnostic enemas. They contain radio-opaque substances which are used for the X-ray examination of the lower bowel of colon part. Example is barium sulfide suspensions. Now, the formulation of enemas. This is the device. This is the structure of the device that we use to administer the enemas. Formulation of enemas contain medicaments like laxatives. Laxatives can be also used like glycerin and soft soap. Sedatives like chloral hydrates and anthelmetics like casein. Drug must be solubilized in a suitable solvent. Method of preparation is simple solution method. We just have to dissolve all the ingredients, all the excipients in the desired vehicle. My next preparation is eye drops. Eye drops are the sterile, aqueous, oily solutions or suspensions intended for installation in the eye sac. Eye drops may contain buffers, stabilizing agents, dispensing agents, solubilizing agents, antioxidants, and the agents required for tonicity and viscosity adjustments. They usually contain drugs having antiseptics, anti-anesthetic, anti-inflammatory, and myotic properties. Single dose containers should not contain any microbial preservatives, any antimicrobial preservative. But if we are using a multiple dose container, it should be these antimicrobial agents should be added in it. The maximum size of the container is 10 ml. For the formulation of eye drops, the ingredients that we need first is drug. They contain the drugs of the various categories, including antiseptics, anti-inflammatory agents, and the agents having myotic properties. Preservatives are also added in the eye drops. Eye drops should be sterile and should contain the preservative to avoid any microbial contamination when the container is open. These preservatives for the ophthalmic use includes chlorbutanol, phenyl mercuric acetate, phenyl mercuric nitrate, and many more. Sterilization is also an essential and important step in the preparation of eye drops. Eye drops are sterilized by autoclaving them at 121 degrees Celsius for 15 minutes or by bacteria filter. Bacteria filters are used in those cases where the drug is will degrade at higher temperatures. So the drugs that are degraded at higher temperatures cannot be autoclaved. For that, we have to use these bacteria filters. Example: protective chlorobutanol hydrolyzed at high temperature. Isotonicity should also be maintained in the eye drop preparations. All the solutes, including drug, contribute to the osmotic pressure of the eye drops. Therefore, isotonicity of the formula should be calculated and it is adjusted with the sodium chloride. Example: 0.9% of the sodium chloride and 1.9% of the boric acid are the isoosmotic gives the osmotic pressure, and we can use these to control the isotonicity of the formulations. Why isotonicity is essential? Because I have already discussed. Because if the solution is hypertonic in nature, it will shrink the cells. But if it is hypotonic in solution, it will cause swelling and bursting of the cells. So if the tonicity of the solution in the eye drop is not maintained, it is going to irritate our eye, or it can also cause redness in the eye. Buffers are also used in the preparation of the eye drops. The buffer should be added to maintain the balance between the comfort, solubility, stability, and activity of the drug. For example, the hydrolyzed chlorbutanol forms hydrochloride acids having a drop acid, whereas certain drugs like pilocarpine hydrochlorides are acidic in nature. On the other hand, certain drugs such as alkaloids shows precipitation at lacrimal pH. Boric acid, monoboric sodium phosphate are the common buffers that we used in the preparation of the eye drops. Viscosity also plays an important role in the preparation of eye drops. The size of the drop and its resistance in the eye depend upon the viscosity of the eye drop. Methyl cellulose, hydroxypropyl methyl cellulose, and polyvinyl alcohols are used as the viscosity enhancers. For the preparation of eye drops, there are 4 stages. The first stage is to prepare a bactericidal and fungicidal vehicle. For that, the aqueous or the oily vehicle is used in the preparation of the eye drops. The aqueous vehicle may support bacterial and fungi growth. So, the following bactericidals may be used for the preparation of eye drops. We can use phenyl mercuric nitrate or acetate in the concentration of 0.002%. Benzalkonium chloride can be used in the concentration of 0.01%. Chlorhexidine acetate can be used in the concentration of 0.01% to prepare a bactericidal and fungicidal vehicle. The second step in the preparation of eye drop is to dissolve the medicament in the aqueous vehicles. They contain the aqueous vehicle that we have prepared in the first step is dissolved. The medicament is dissolved in that aqueous vehicle in the second stage. The third stage is clarification. The eye drops are clarified by passing the solution through the membrane filters having pore size of 0.8 micrometer. The clarification solution is immediately transferred to the final container and sealed to exclude the microorganisms. After clarification of the after passing it from the pore size of 0.8 micrometer, the solution is sealed immediately. And the last and the most important step in the preparation of eye drops is the sterilization. The eye drops are sterilized by autoclaving or by heating with bacteriocidage at 98 degrees Celsius to 100 degrees Celsius for 30 minutes for the filtration through the bacteria-proof filters. So, in today's lecture, we have discussed about the different types of monophasic liquid dosage form, and we have also discussed about the classification of the monophasic liquid dosage form.